The private hospitals are gearing up to join the second phase of vaccination drive for COVID. Government has designated 24,000 private hospitals to vaccinate people from the 1st of March. People will have to pay to get vaccinated at private hospitals. Only the private hospitals which have been listed under Pradhan Mantri Jan Arogya Yojana have now been chosen for the phase 2 of the vaccination drive. However, the vaccination is going to be free at the government hospitals. So while you have to pay for the private ones, it's going to be free at the government hospitals. People over 60 years of age and those who are above 45 with comorbidities are going to be vaccinated in phase 2. As per the initial discussions in the health ministry, what we're picking up is that the private hospitals may just not be allowed to sell the doses, but they may charge a nominal fee for administering COVID vaccines, as the health ministry is yet to fix the vaccine selling price for private players. There is still no clarity on whether people are going to be allowed to choose the vaccine they want to take or not. Meanwhile, you've got the WHO chief who has thanked India for supporting over 60 countries for vaccine procurement, asking other countries to follow this example. Let me cut straight across to my colleague Akshita Nandgopal, who's going to be standing by, who's going to be explaining to us how one can get vaccinated. Over to you, Akshita.
Here's a look at how citizens will get vaccinated. First, you will need to download the CoWIN app to self-register, saying that you are someone who falls in this category of the vaccination phase. This app can be downloaded for free. It will be available on all platforms. March 1st is when the vaccination process begins for senior citizens. Now, this app will not just help those who have to get vaccinated. It also helps the administrators in tracking and monitoring the process. It gives you real-time information. So it will monitor the process very, very closely, give us details of how many vaccinations have been administered. The app will also verify beneficiary details. So if you want to get vaccinated, you'll have to put forth certain details on the app. You'll have to upload it, and then your turn will come to get vaccinated. Each vaccination, the time that's been given is 30 minutes. This is for the entire process, from getting the necessary registration forms to getting the vaccination, and then for a brief period, you will be monitored as well. 100 people will be vaccinated in each session. This is the target that's been set by the government. The process is elaborate. It's very clearly in place. So looks like things will be smooth come March 1st, when senior citizens, people with comorbidities, will get themselves vaccinated.
Time now for our special COVID segment, the good, the bad and the ugly. Here is a report filed by my colleague Milan Sharma. Take a look.
There's good news because not just the 60-year-olds who were earlier the priority group to get the vaccines from the government, but even if you are above the age of 45 years and have comorbidities, you are eligible to get the COVID-19 jab. The government has said that those above 45 age can go to either government facilities or private facilities to get the COVID-19 shot. In fact, there are 10,000 such government facilities where the vaccine will be given free of charge, and at private facilities, which are 20,000, a price will need to be paid. But those above 45 age have to remember that they have to show proof of their comorbidities. So, for example, if you have diabetes or if you are hypertensive, if you're on coagulants or any other comorbid issue, you will need to show a proof that you can procure from your clinician or doctor that you've been consulting. So therefore, not just the 60-year-olds, but also the 45-plus category of people can now get inoculated against the COVID-19 virus. Well, some bad news now emerging on the virulent strains front. We already know about the UK strain, the South African strain, and the Brazilian strain. But the New York City is looking at a new and virulent form of the COVID-19 virus strain. In fact, the researchers there are saying that it's responsible for at least 12% of the COVID-19 cases in New York City. The strain has been named B1526, and it has similar properties to the United Kingdom strain. But there's a possibility that the vaccines may get another booster shot in the US so that more protection is created against the virus. Now, this is bad news because we already have three strains in India, the UK strain, the South African and the Brazilian strain. But at this point, the government has said there's nothing to worry, and the vaccines that we have in India, which is Covishield and Covaxin, are seen to be working against the virus strains. Well, news on the ugly side of the COVID-19 pandemic is emerging from Maharashtra once again, in the Washim district that has been news for flouting social distancing and COVID norms. Now, 229 teachers as well as those living in the hostel in Washim district have tested positive for COVID-19. The area has now become a containment zone. This was after the RT-PCR tests of about 327 people were done, and out of that, shockingly, 229 have tested positive. That's the total figure that we're getting to you right now. Initially, there were 21 who had started testing positive from that place. And also the fact that there's been a spurt of coronavirus cases in Maharashtra. All these students are mostly from districts of Amravati, Yavatmal and Hingoli and other neighboring districts that are witnessing a massive surge in COVID-19 cases in Maharashtra.
Hello everyone, this is Rahul Kamal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel, and don't forget to press the bell icon to stay updated.